Have you ever wondered if the medication you take every day might be slowly damaging your brain? It may sound like an exaggeration, but the truth is deeply unsettling. There are common medications used by millions of people around the world that silently impair cognitive function. And we're not talking about rare or experimental drugs. We're talking about over-the-counter cough syrups, sleeping pills, painkillers, cholesterol-lowering drugs, fever reducers, and more. Medications taken for years without anyone fully explaining their effects on the brain. If you've recently noticed your thinking slowing down, forgetting where you left your keys more often, or having trouble focusing, the cause might not be stress or age, but rather that pill you take daily, trusting it's helping your health. In this video, we'll reveal 7 types of medications that may be sabotaging your brain without you even noticing. And be careful, one of them is more concerning than all the others. Let's start with the first major group: benzodiazepines. You've probably heard of them. Medications like clonazepam, diazepam, lorazepam, commonly prescribed for anxiety, insomnia, or seizures. What many people don't realize is that these medications, when used over a long period, can have truly devastating effects on the brain. They enhance the effects of substances that reduce brain activity, causing deep sedation. And while that can feel helpful at first, over time it begins to impair thinking, reflexes, and mental sharpness. Used short-term and under medical supervision, they can be helpful and effective. But when used chronically, they become problematic. Today we know that long-term use of benzodiazepines significantly increases the risk of dementia. These medications slow down neuron activity and interfere with the brain's ability to form new connections, the very foundation of learning and memory. Over time, this interference leads to mental decline, especially in older adults. And what's worse, many people continue using them for weeks, months, or even years, believing they're completely safe, unaware of the accumulating damage. Even more alarming is that these drugs can actually worsen the very symptoms they were prescribed to treat. For example, insomnia may return stronger than before, a rebound effect. Temporary amnesia is also common, with people experiencing frequent memory lapses and forgetfulness that gradually erodes their quality of life. Another serious side effect is the increased risk of falls and accidents, particularly in older individuals. Because these medications cause sedation, drowsiness, and slower reflexes, the chances of losing balance or suffering a household injury go up significantly. What starts as a solution for anxiety or sleep can quickly become a threat to both mental and physical health, especially when used without proper monitoring or for extended periods. That's why, if you or someone close to you has been using these medications continuously, it's crucial to speak with a qualified healthcare provider. Gradually tapering the dose, switching to safer options, or even exploring natural remedies can help reduce risks and restore clarity. But be careful. Never stop taking these medications abruptly. Sudden withdrawal can result in severe symptoms like intense anxiety, tremors, insomnia, and even seizures. Any changes should always be done under medical supervision. And if this already seems serious, get ready, because next, we'll talk about medications you probably think are harmless, but which may be slowly impairing your memory and concentration without your knowledge. Now let's talk about a group of medications that seem harmless, many of them even sold over the counter, but can deeply impact your memory and cognitive abilities. These are the anticholinergic drugs. They're commonly used to treat allergies, rhinitis, colds, nausea, urinary incontinence, asthma, and even mild sleep problems. But here's the issue. These drugs interfere with a vital chemical in the brain called acetylcholine. Acetylcholine is a neurotransmitter essential for memory, learning, and concentration. It helps the brain form and maintain connections between neurons. So when a drug blocks or reduces the activity of the substance, day after day, week after week, the brain slowly begins to lose efficiency. Thinking becomes slower, focus gets harder, and short-term memory starts to fade, often without anyone realizing why. Among the most common anticholinergic medications are first-generation antihistamines like diphenhydramine, found in many cough and sleep aids. Also included are drugs for overactive bladder like oxybutynin, as well as certain nasal sprays or bronchodilators with anticholinergic effects. In other words, everyday medications, found in millions of homes. And this is exactly where the danger lies. Because many of these drugs are available without a prescription, people take them casually, without realizing they may be affecting their brain. A long-term study published in a respected scientific journal showed that continuous use of anticholinergic drugs doubles the risk of developing dementia. Why is that so concerning? Because the damage doesn't happen overnight. It builds up slowly. A person starts with small memory lapses and doesn't think much of it. Then, they have trouble concentrating or completing tasks that used to be simple. Confusion becomes more frequent. And all of this is often blamed on aging or a busy lifestyle. But the real cause may be something they're taking regularly, without question. Early signs that something's wrong include difficulty focusing, frequent forgetfulness, and brain fog throughout the day. Many describe it as feeling mentally cloudy, like their mind is no longer fully awake. And the scariest part is that these symptoms are often ignored, while the medication continues to be used. And with it, the brain damage continues to accumulate. Another side effect of anticholinergic medications is excessive drowsiness at unusual times. This not only impairs mental performance but also affects physical balance, especially in older adults. Dizziness, poor coordination, and persistent fatigue may seem like minor issues, but they are real warning signs. And it's important to know, the risk doesn't just depend on high doses. Even low doses, when used regularly, can negatively affect the brain. In older adults who already have less neuronal reserve, the effects can be even more severe. That means even a small amount of an allergy pill taken nightly could contribute to cognitive decline. The problem is that most people don't even realize they're taking an anticholinergic drug. These substances are hidden in cold medicines, nausea remedies, and nighttime formulas for better sleep. The biggest danger is not knowing what you're really taking. If you or someone close to you has been using these medications frequently, it's a good idea to speak to a healthcare provider. Safer alternatives are often available, options that don't interfere with acetylcholine or compromise mental clarity. And for any long-term treatment, it's essential to monitor cognitive health closely, before the damage becomes too deep to reverse. And if this has already surprised you, get ready. Because what comes next involves medications that are not only extremely common and widely prescribed, but also considered essential for preventing serious illnesses. But at the same time, they may be quietly reducing your mental clarity in ways few people recognize. Now we come to a group of medications taken by millions of people around the world every day, often considered essential to prevent heart attacks and strokes. The statins. These include familiar names like simvastatin, atorvastatin, and rosuvastatin. There's no denying their effectiveness in lowering cholesterol and protecting the cardiovascular system. But what few people know is that these very same medications, when used over long periods, can affect brain function in subtle and serious ways. At first glance, it seems contradictory. How could a drug that protects your heart also harm your mind? The answer lies in the delicate biochemical balance of your body. The brain, like the heart, depends on certain compounds to function optimally. And with statins, this balance can be disturbed, especially with long-term use. One of the key issues is the reduction of coenzyme Q10, a molecule essential for energy production in your cells, including brain cells. When this nutrient is depleted, your brain has less energy to perform its tasks efficiently. That leads to symptoms like mental fog, poor concentration, and difficulty with memory, particularly short-term memory. Many people who take statins over time report feeling off, as if their thoughts are slower or less sharp. They struggle to focus, forget simple things, or feel mentally fatigued. The problem is that these symptoms are usually blamed on aging, stress, or even depression. Rarely does anyone suspect the medication. However, multiple clinical studies have shown a connection between long-term statin use and cognitive side effects, particularly in older adults or those who already have mild memory issues. And that's not all. Statins have also been linked to mood changes such as irritability, apathy, persistent sadness, and a general flattening of emotional responses. What makes this more concerning is that these side effects often go unrecognized by both patients and healthcare professionals. Since statins are so widely accepted as safe, their long-term impact on cognitive health is frequently overlooked. That's why close monitoring is crucial, especially for older adults. If someone begins to show signs of memory loss, reduced mental clarity, or emotional blunting while on statins, those symptoms shouldn't be dismissed. In many cases, doctors may recommend supplementing with coenzyme Q10 to counteract the deficiency and protect brain function. There's also the possibility of adjusting the dosage or exploring alternative treatments in certain cases, always under medical supervision. The key is not to stop statins without guidance, but to recognize when the side effects may outweigh the benefits. Protecting your heart is important, but preserving your brain is equally vital. And when it comes to medications like statins, the balance between benefit and risk should be evaluated regularly. Because mental clarity, memory, and emotional stability are not things anyone should have to sacrifice in silence. So if you or someone you know is using statins and has noticed increased forgetfulness, brain fog, or a decline in focus, speak with a trusted healthcare provider. A small adjustment might make a big difference. And if you think we've already covered the most dangerous medications, think again. Up next, drugs commonly used to treat depression, chronic pain, and sleep disorders, but that may be quietly degrading your mental performance over time. Not all medications that affect the brain are sedatives or meant to calm the nervous system. Some were developed precisely to support mental health and emotional balance, yet over time may quietly do the opposite. This is the case with tricyclic antidepressants, such as amitriptyline and nortriptyline. Although these medications are older, they are still widely prescribed today. Not just for depression but also for chronic pain, migraines, sleep problems, and other conditions. They work by altering the levels of neurotransmitters like serotonin and norepinephrine. While this can help regulate mood, tricyclic antidepressants also have strong anticholinergic effects. And as we've already seen, these effects can seriously interfere with memory, learning, and concentration. When used for extended periods, these drugs can lead to a growing sense of mental fog, memory lapses, slowed thinking, and difficulty focusing. These effects tend to be especially pronounced in older adults, whose brains are naturally more sensitive. But younger people can experience these cognitive side effects as well, especially when taking these medications daily over months or years. It often starts subtly. Someone might take the medication to help with sleep or chronic pain and initially feel better. But over time they begin to notice changes. Simple tasks become harder. Words are harder to find. Thoughts feel slower. And because this happens gradually, it's rarely connected to the medication. Instead, people blame stress, exhaustion, or aging. The truth is that these medications interfere with essential brain chemicals, preventing the formation of new neural connections and slowing down information processing. And the longer the interference continues, the more deeply it can affect day-to-day cognitive performance. Many users also report a kind of emotional flatness. They feel disconnected, not particularly sad, not happy either, just emotionally numb. This can be mistaken for worsening depression, prompting an increase in dosage, which only worsens the problem. But it doesn't stop with memory. Tricyclic antidepressants also affect balance and coordination, which significantly increases the risk of falls, especially at night. Getting up to go to the bathroom can become a dangerous moment, particularly for older individuals, who may already have limited mobility or weaker reflexes. What's truly concerning is that most people taking these medications long-term are never warned about these risks. Many simply accept brain fog and forgetfulness as part of life, unaware that the cause may be a medication they've trusted for years. Fortunately, there are modern alternatives available. Today's antidepressants often offer similar emotional support without the same level of cognitive impairment. In many cases, natural or integrative approaches can also help without compromising mental clarity or stability. So if you've noticed your thinking becoming slower, your memory slipping, or your emotions feeling blunted, and you're taking a tricyclic antidepressant, speak to a healthcare provider. A change in medication may restore your focus and emotional vitality. And if you thought the medications we've covered so far were the most dangerous, wait until you hear what's next. The final three on this list are some of the most widely used and often overlooked, but can pose serious hidden threats to your brain health, especially when taken for long periods without proper monitoring. To close this important topic, we now turn to 3 more medications that aren't specifically designed for the brain, but can seriously affect its function, especially when used long-term or without proper oversight. These are corticosteroids, sleep aids like zolpidem, and the widely used metformin, a common treatment for type 2 diabetes. Let's start with corticosteroids, such as prednisone or dexamethasone. These drugs are frequently prescribed for inflammation, autoimmune conditions, severe allergies, and joint pain. Their anti-inflammatory effect is powerful, but when used in high doses or for extended periods, they can disrupt the brain's delicate chemical balance. They influence neurotransmitters like serotonin and dopamine, which are crucial not just for mood, but also for memory, focus, and cognitive stability. People who use corticosteroids long-term often report mood swings, anxiety, insomnia, mental confusion, and even personality changes. In more severe cases, hallucinations and psychotic symptoms may appear. More worryingly, studies have shown that corticosteroids can lead to atrophy of the hippocampus, the part of the brain responsible for memory and learning. And in some cases, this damage may be irreversible, especially if the medication is used without proper medical monitoring. Next are the so-called modern sleep medications, such as zolpidem. These were developed as supposedly safer alternatives to benzodiazepines, as they are designed to target only the sleep-regulating areas of the brain. But research has shown that the sleep they induce is not natural. These drugs suppress deep sleep stages, the ones responsible for the brain's nightly cleanup, repair, and memory consolidation. As a result, while users may feel like they're sleeping better at first, the brain isn't truly resting. Over time, this can lead to mental fatigue, concentration problems, and short-term memory issues. What's more, these medications increase the risk of nighttime falls, especially in older adults. A simple trip to the bathroom can become dangerous when the mind is foggy, the balance is off, and the reflexes are dulled. And now, one of the most surprising items on this list. Metformin, a frontline treatment for type 2 diabetes. This drug is highly effective and widely trusted. But few people realize it has a hidden effect on the brain. It can interfere with vitamin B12 absorption, and B12 is essential for maintaining a healthy nervous system and proper brain function. A vitamin B12 deficiency can cause memory loss, mental fog, fatigue, and even nerve damage. In more severe cases, symptoms may closely resemble those of dementia. And the most concerning part is that many people who use metformin for years never get their B12 levels checked. But the problem isn't metformin itself. It's the lack of monitoring. A simple annual blood test could detect and prevent this issue early. If you or someone you know takes metformin and has experienced memory decline, confusion, or persistent tiredness, it may be worth checking vitamin B12 levels. A small adjustment can make a major difference. What all of this tells us is clear. Many everyday medications, even the most trusted ones, can have silent long-term effects on the brain. The key is not to panic or stop taking medications on your own. The solution is awareness, regular checkups, and open conversations with health professionals. You have the right to ask questions and make sure that what you're taking is truly helping, not slowly harming your memory, clarity, or emotional stability. If this information helped you, consider sharing it with someone who might need it. And if you've personally experienced cognitive or emotional changes while on any of these medications, leave a comment. Your story might help someone else take action in time.